This is Ireland, 3 years old, degenerative disc disease. And the owner of this dog was a nurse, and he brought her in to be euthanized because he didn't think anything could be done. This is her 3 weeks later. No steroids, no surgery. We did chiropractic, acupuncture, laser, all the natural things that we do, and she never relapsed.
Hi, Richard Fluke here, Guiding Healing Energetically. And what you're about to listen to is part 2 of a 3-part series with me and Dr. Marlene Siegel. And she's going to take you through some incredible slides and movies that honestly will change the way that you look at how we as humans can heal. We're both involved with looking at different ways of healing that don't involve the traditional medical way of looking at things. I wrote the book, How Can I Heal?, which covers all of that. She's a veterinary surgeon. You may be asking yourself, well, what's the connection? Well, the medical profession experiment on animals first. But what I want you to do is just watch this next bit. If she can do this with animals, you can do this for yourself and you can heal. So let's go on and listen to what else she has to say.
So another tool that we use is detoxification is our ion foot bath. And again, this is using a microcurrent to draw toxins out of the body, particularly heavy metals. And the animals tolerate it really well. If they are big, like the dog on the left, we just put the feet in. And if they're small, they just do a little body jump. They put the whole body in, and they do marvelous with this. This is Popcorn again. This was him after he got his lymphatic. He goes into the foot bath and really enjoyed it with his mom. Now I want to talk a little bit about vibration and sound frequency, because I already mentioned that we are light beings, but we are also frequency-based human beings in the planet. And we are bombarded with so much EMF and frequencies that are throwing our body off. This is a machine that we use to bring our vibration back into harmony, back into the entrainment of frequency that our body is supposed to be at. So we just set them on. It's a vibration plate, and then we have a program that plays various frequencies. And I want to show you how intelligent nature is. So these are 2 snakes that came to me. The owner had just purchased them, and he just didn't think they were right. He thought, we use the term ADR, ain't doing right. So I said, on physical exam, I couldn't find anything really wrong with them. But I said, let's go ahead and put them through a little frequency. And I use things for helping them to get parasympathetic and to reduce inflammation. And so I picked frequencies that would be healthy for them. And watch this. They're curled up literally underneath the little black thing, which the frequency is coming out through that black little thing laying on their cage. And they were all scattered in their cage earlier, and they came right underneath where the concentration of the frequency was to be most underneath it. That was just amazing to me. So this is a little dog that had come to me. She was only 8 years old, really not that old, and she couldn't pee when she went to her first veterinarian. And the veterinarian correctly diagnosed her with a bladder cancer and told the owner that there was nothing she could do and she just needed to put the dog to sleep. Well, owner didn't like that answer. So she went to another local veterinarian who told her the same thing. And then she went to a referral center who told her that not only was it not operable and there was nothing she could do, but if she left that clinic with this dog alive, she was a cruel and inhumane pet owner. And she left anyway. And then she came to me, and we started her on the frequency machine. This is a picture of ultrasound of her tumor in her bladder, and it was literally obstructing the ability for her to pee. But we started our frequencies. We did our 6 steps. We started her on the vibration plate. And this was her 1 year later, still with us, still able to pee, and having quality of life. Now, we ultrasounded her again, and the tumor was still there, but we didn't have to euthanize her. At some point she's going to pass, but that's, another entire year of quality of life. Salt therapy is magnificent. I think in Europe, a lot of people would go into salt caves. And so this became a very popular treatment for doing anything in the respiratory tract, the eyes, and the skin, because salt is a desiccating agent. So it helps to pull bacteria and mucus and nasties out. And it's like taking a toothbrush and scrubbing your mucus lining, right? It cleans it all off so it can work better. And I'm going to show you this case who was Beavis. We get feral cats who get these upper respiratory tract infections, and they are intense. Most of these cats turn into chronic shedders so that they have chronic nasal infections, chronic sinus infections, and they're always shedding. So they're infecting everybody around them. And this is a huge issue in catteries. So we put him in the salt booth. We also did ozone, changed his diet, and supported his gut health. This was him after his first 24 hours in the salt room. You can see his nose is running, his eyes are tearing. This stuff is coming out. This is 72 hours. We treated him every day for 3 days in a row. Totally cleared up and has never relapsed and never had another problem. So not to say that, I'm trying to say this delicately, most veterinarians would have put him on massive amounts of antibiotics, anti-inflammatories, which are very destructive. They have side effects. What we did had no side effects, and he was totally cured in 3 days. Did you talk about ozone in the book, Richard?
I don't talk about it, but I love ozone. We both know a lot about it. It just got too complicated. But you
So I'm just going to briefly mention it because ozone is made in the stratosphere. When we have lightning storms, we used to be able to smell that ozone after a big lightning storm. When I was a kid, it smelled so fresh and clean. I don't smell that anymore, even after a lightning storm. Ozone is also made by our mitochondria as a byproduct of ATP production. So as a byproduct of making energy, the mitochondria actually produce ozone, and it becomes a redox signaling molecule, which means that it helps to transmit information down the chain, kind of like a cell tower. When we make a phone call from a cell phone, miraculously, it hits Richard in Europe when I'm calling him. And it's because this ability to transfer that signal all the way in ozone is one of the things that helps to do that. So it has many, many applications. It's antimicrobial, antiviral, antifungal. We use it in a multitude of ways. And what I love about this is you can do this at home. So we have these little ozone kits that people can purchase and be able to do this at home. This is not in lieu of getting a good physician to help you with a good diagnosis and support you, but this is a therapy that is very safe and effective and can be used for a lot of different things. Now, a lot of the way we use ozone is rectally. So we take a gas, we put a catheter up the butt, and we literally inject the gas. And people go, well, how is that doing anything? So I want to show you the fourth phase of water. So on the left is before we have, this is a dog, and before we have actually given him ozone, you can see the cells are gnarly. The fourth phase of water is collapsed. This was a sick dog. And on the right, you see the cells, this is 10 minutes later, are separated. And there, you can see the cells are moving. Look at the difference in energy again. In all of these examples I'm showing you of how when we expand that fourth phase of water, the cells are able to flow and have life to them, where on the left-hand side, when they're all stuck together, they're not doing anything. I mean, these are both videos, and you can see that there's just no movement and life to the cells. You want to comment anything, Richard, or we'll keep going?
Can get ozone therapy in all parts of the world. Most of the therapists that do it, they have to be medically trained. Most of them, not all of them, and you won't find them in the when you're searching really underground stuff. I don't know why. It's fantastic therapeutic intervention, and you can get it for humans. Incredible stuff used in all sorts of wonderful ways. Back over to you.
Another thing I wanted to mention about ozone is that yes, it is very, very safe, but there are thousands and thousands of publications on PubMed. The research behind it is incredible, and yet we'll put that, some of our pet owners have pet insurance, and so we'll put that on the bill, and they'll deny the ozone therapy, and they'll say, oh, well, there's no science behind it. And then I send them literally thousands of publications on the human side of ozone therapy. There's books written. So yeah, it's kind of sad. I think it's part of the pushback on the allopathic world to do something that is so safe and so effective and no side effects. How incredible is that? Well, let me move into allergic skin disease, because if we have pet parents on here, next to cancer, I think allergic skin disease is probably the most common thing that we see. And of course, it's coming from the diet, the water, the processed foods, the leaky gut, the toxins, and all that. This dog was a Great Dane, 4 years old, and she had been to 3 previous veterinarians for itching that was incessant. This dog could not stop itching at any point in the day. And she had these terrible ulcers in her skin everywhere. On the left is the outside of her thigh. The middle picture is the inside of her thigh, and you can just see there's craters in there. And then on the right, that's her chest. So it covered her entire body. We did skin biopsies because I was not going to be failure number 4. So we got a thorough diagnostic workup. Our answer came back allergic skin disease. We started changing the diet. Within 3 days, this dog was not itchy. And this is 3 weeks. Her skin is totally cleared up.
So this was just a change in diet, or did you do other things? You did ozone as well.
Diet. We got her in a parasympathetic state. I think on this dog, I did use antibiotics because she had 2 organisms that were resistant to almost everything. 2 bugs I'd never even heard of before. So I did put her on antibiotics for 7 days. But she was clearing up even before the antibiotics kicked in. Ozone was one of our primary therapies on her, in addition to getting her off all processed foods and restoring gut health.
Let's talk quickly about processed foods. What's the major diet of most people's?
It's interesting. So a lot of the people that are waking up on the human side and they're eating healthier themselves haven't made that connection to their pet. When they take my course, they go, oh, I never connected the dots about food and water. I mean, they're still giving their pets tap water, which is full of thousands and thousands of carcinogens. So they just weren't putting the pieces together. But now they're starting to realize that there's a lot more things that they can do. And processed foods is anything that's been heated above 105 degrees and has been extruded and put all kinds of chemicals in it. And oh my gosh, just read the bags of what is in this pet food, and it is horrific, loaded with genetically modified organisms and toxins out. Incredible. So it's no wonder that we're seeing cancer at the rates that we're seeing them, considering the amount of toxicity that we're overwhelming these pets with. So this is,
but just before you go on and on to the next pet, when it comes to food as well, but people will say, but I get this, I pay a fortune for this stuff from the vet.
Exactly. And because they pay a fortune for it, they think it's good. And don't blame your veterinarian, guys, because when I went through school, we were taught nothing about nutrition. It was literally a few hours, and it was taught by the big box companies. And they said, here, we have your solution. So if you think about it, it's interesting. They have a diet for every age. Now think about it. When these animals are in the wild, think about lions and tigers. Do they actually have little lion baby food? Do they have lion old food? No, they're all eating the same food, right? They're eating the same diet, but it's healthy. And then when we talk about illnesses, now it's symptom suppression in our world. So it's a diet for every disease. But the problem is they're not fixing the underlying cause. So now that symptom that you just took away and suppressed is now going into deeper disease into the body, into the fascia, and now it's going to express itself in something more severe. And then in our allopathic world, we have a new symptom to suppress for that. And we have to get away from symptom suppression and start talking to the body and acknowledging that it's talking to us. It's giving us a signal that there's something wrong. What can we do about it? So there you go. All right. You want anything else you want to say on that?
No, carry on. I just love it.
So here's Ritz. He's 14 and a half years old, and he comes in circling acutely. Just woke up in the morning. He's circling like this. Most people would give him a brain tumor, and most veterinarians would suggest euthanasia at 14 and a half years of age. I will not do that. He also had a really severe ear infection because I do a thorough exam, and we treated him with ozone and laser therapy. So blue light is antibacterial, antiviral, and fungal. And then red light is stimulating collagen production and tissue healing. This is him the next day. No antibiotics. This is him the next day. Head tilt is gone. Circling is gone. Ears are comfortable. Happy dog. This is Abby. I'm giving you a lot of variation, everybody, so that you can see that what we do isn't just for one process. It's a lifestyle. It is a way of supporting the body no matter what the problem is, and it is very safe and effective. So this is Abby. She came to me not thriving. She was under 2 years of age, vomiting, diarrhea. This is how sick she actually looked. And the people who owned her couldn't take care of her. So they gave her to somebody that I knew. And those people brought her to me. We did a thorough workup, and she had a liver shunt. So we sent her to the University of Florida to see if she was a surgical candidate to fix the liver shunt. And what that means is that the blood that is supposed to go through the liver to get detoxified and come out the other end wasn't going through the liver. It was going around the liver. So all this blood had all these toxins in it. Well, when the university worked her up, they found that she did not even have the main vein that goes into the liver. So there was nothing they could surgically do. And they told this owner that she would never thrive and that they should consider euthanasia. They didn't want to do that. This is her 3 years later, because they came back to me and we created a protocol, which included diet, and she came in every month for therapy. And how cute is that? That's the money shot right there. This dog had 3 years of incredible quality of life. Now, she didn't live forever. She ended up developing an acute immune-mediated thrombocytopenia. She wasn't able to make platelets, and she ended up passing. But incredible quality of life for the time that she had. Left, how she presented, right, amazing quality of life. Hyperbaric oxygen, I cannot say enough wonderful things about hyperbaric oxygen. I think everybody should own a soft-sided chamber in their house. And on the left is me diving with 2 of my cancer patients. You'll see Moon on the left here later on, and then Bo on the right. And Bo actually had an anal gland carcinoma, which we treated, and it never returned. And then he, about a year later, developed an oral melanoma, very aggressive cancer, and it never progressed with our therapies. And then I'm just showing you on the right-hand side, that's my toes in there. I'm diving with a patient just to show you how much room is in there. It's really very comfortable. Oreo is a 7-year-old male neutered kitty cat that came in kidney failure. And a lot of veterinarians do not know how to treat kidney failure, and they give these cats a very poor prognosis. So I don't know what tripped him into it, but all the red are all the abnormal. So creatinine is one of the measures. 6.4 is very high. BUN was 76, another measure, very high. And the SDMA is a long-term measure of kidney function, exceedingly high. Phosphorus was high. So this cat was in poor shape. But we didn't give up. We started treating him with ozone and lymphatic therapy and IV fluids and hyperbaric and all the things. And this slide is to show you that within 72 hours, his blood work returned to normal. And he is just one example of the many cases that I've done this with. And not to say that every case is going to be a success, but many of them are, and he never relapsed. Oh my gosh, this is Cookie. This case touches my heart because this dog was correctly diagnosed with inflammatory bowel disease. I think there's a lot of owners out there that suffer from Crohn's disease or IBD. And this dog was told that there was nothing more that could be done to support him. And so for 4 years, this dog 3 to 4 times a week would have vomiting, would have terrible diarrhea, would stop eating, terrible stomach cramps. I mean, really suffering. Came to me, we started our therapies, and on the left shows 4 days in a row progression. And on day 4, this dog had a normal bowel movement. And with our supportive care and the lifestyle changes the owner made, he continued to have a normal, healthy life. Rocco, 8 years old, was a rescue pit mix and had chronic skin disease the whole time this owner owned this dog. And he suddenly developed a head tilt and severe ear infection, went to their vet. The vet wasn't able to treat it successfully, so they went to the referral center, where they loaded this dog up on so many drugs and antibiotics and anti-inflammatories, and he got worse and worse. And so finally they said, nope, we're going to go a different route. They found me. This is the dog when he presented to me, severe head tilt, and his legs are kind of wide apart because he was real wobbly. He didn't have good, you can see he's going left and right, and that's because he couldn't go straight. So we started our therapies, and I literally focused on inflammation, because inflammation is the linchpin, that's the underpinning of all dis-ease. And so this is him after his first treatment with us, which included the photodynamic therapy. We sent him home with a diet change. We did his lymphatic, chiropractic, all that kind of stuff. And you can see his head is already starting to get straighter. This is him 10 days. I really want to emphasize how quickly these animals heal. In 10 days, he would have 3 treatments, symptomatic free, and for the first time in his life, his skin cleared up. So all I did was treat the inflammation. I treated the root cause, and everything else went away. Richard?
I'm just in awe of it. You know, I am. You've shown me some of these slides before, and I'm just like taken aback. So, and
But
you know, I talk
owners,
about inflammation in the book.
well,
Yeah.
inflammation is really the underpinning of all our dis-ease. I don't think there is a disease. I think there is dis-ease. I think it's the body not being in homeostasis, it's not being in balance, and it's telling us, it's showing us, it's trying to get our attention, and we're not listening. So this is such a power. This dog and Holly, the Great Dane with the skin disease, are such important examples for pet parents to know that there's other things than these immune suppressive drugs that are being given to these animals that ultimately fail anyway. Really important.
And I think also, let's just put this into context. I'm going to come back to it. You can do this with animals who can't talk, can't tell you what's going on.
Mm-hmm.
But
It's still understanding biology.
I can't. Why can't I do that with a human? Well, we can ask. You can work that out yourself.
I think as we become a more awakened group of people, I think people are, and actually I'll tell you, people are seeking me out because they are tired of a pill for an ill. They're tired of the relapses. They're tired of constantly having to do drugs, and they want something better. Sometimes it's a little challenging because they have to change your lifestyle. You know, this is, Einstein said, you can't do the same things, that you can't have the same behavior and expect a change of outcome, right? You have to do something different. And he also said you can't solve the modern problems with the same mindset that created them. So, you know, we've created our problems. Let's just own it. We've created fast, cheap, and convenient. Now is our opportunity to say, how do we get back to our roots? How do we go back to being outside and grounding? And Richard, you taught me to start my day by literally going outside and seeing the sun at dawn and resetting my circadian rhythm. It's huge. So we just need to take our life back. Simple as that. This was a Lyme's case, real quickly, came to me, had failed for 6 months, other therapies with other veterinarians, and we had this dog feeling better within 4 days. Paralysis, we see a lot of this. It's becoming much more prevalent. This is Sammy. He was 15 years old, became acutely paralyzed. Owners took the cat to their vet. The vet said he had to go to a referral center. So they went to the referral center, and they said, Sammy's 15 years old, and he probably has cancer in his spine. He probably has lymphoma, and you should just consider euthanasia. Well, they didn't want to do that. So they came to me. This is 4 days. He's crab walking, but he's off the ground. And and if that's all she ever got to, they would have been happy because she could use her litter pan. This is 4 weeks later, and she's still not quite right, but improving. Sammy lived to be 20 years young. So I would venture to say she didn't have lymphoma, and she had amazing quality of life. Her owners actually said by the 4-week mark, she was doing behaviors she hadn't done for years. So she had been progressively getting more and more inflammation, progressively getting worse. And then we're reversing that process and giving her body a chance to go back to thriving, right? This is adorable. This is Ireland, 3 years old, degenerative disc disease, just like Sammy had. And the owner of this dog was a nurse, and he brought her in to be euthanized because he didn't think anything could be done. This is her 3 weeks later.
Okay.
Adorable?
Unbelievable.
Yes. No steroids, no surgery. We did chiropractic, acupuncture, laser, all the natural things that we do, and she never relapsed. Another type of disease that we see a lot is cranial cruciate ruptures, and it's becoming so common in our world now. The previous was only surgery as an option. We actually came to this house to euthanize this dog. We were asked to do a house call. But when I started asking about what the dog's problem was, because he was only 5 years old, and they said, oh, we went to the vet, that he can't walk, he can't use his back legs at all. And I did an exam on him and discovered he had bilateral, meaning both legs, ruptured cruciates. And so he couldn't stand up on the legs. They were too painful. But the owners didn't want to give up. Nobody gave them an option. So I gave them an option. We took him back to the office. This is him in surgery. He's on his back. His head is towards the upper end of the screen. And we have done what is called PRP, platelet-rich plasma, which has stem cells in it, and prolo therapy, which is a mixture solution of nutrients and sugar, and then ozone. And we had some other things in there. And then we photo activated it with the Weber laser. So we literally have these needles going into the joint. We injected the materials and the ozone, and then we do the rainbow colors to photo activate the products that we put into the knees. This is him waking up from surgery. This is a dog who was going to be euthanized because he couldn't stand up on his back legs. That is immediately following waking up from surgery. He's walking around my office. And this is him a couple weeks later. Never had surgery to fix the cruciates. He's a large dog. Most surgeons would say this is impossible. And there he goes. And we have many of those cases. So we're getting near the end here. I'm going to speed up a little bit. This was Kit Kat. Chronic urinary tract infections had kept blocking where he couldn't pee, gets crystals in the urethra. And on the 3rd or 4th episode, the owner had tried to express the bladder herself, and she accidentally ruptured the bladder. So that black line that opened up there on the right screen, that was the rupture in the bladder. So I won't show you the cool pictures of the surgery, but he had urine in his abdomen for a couple of days. So he was uber sick, all this inflammation. We removed all the necrotic tissue from the bladder, sewed it back together, and then copious amounts of ozone rinse in the abdomen because he had so much exposure to urine and inflammation and peritonitis. This is him waking up from surgery. He's got a urinary catheter in. He still has his IV catheter. And look, he's moving around. He's feeling good. He's up, where before he couldn't even stand. Right before surgery. And then a week later, we did a surgery on the right to turn him into a her. So we changed the plumbing, and now he pees like a girl, and he's been fine ever since. All right, we're almost at the end. This is Tinkerbell. Tinkerbell was 12 years old, began vomiting. The owner noticed that her eyes were turning yellow, went to their vet. The vet sent them to the referral center. I get a lot of my cases there. And they did a partial workup. They did an ultrasound. They said that the liver was very abnormal, probably had cancer, and her blood work, I'll show you, was horrible. So you can see starting on the right was the original blood work. Some of it was so high, it didn't even register. liver enzymes, bilirubin, which comes from the gallbladder. So definitely she was very, very sick. And the referral center said, there's nothing more that we can do. We can keep her on fluids, but she should be euthanized. And the owner didn't want to do that. So they were going to transfer the dog to me. And the veterinarian at the referral center got on the phone with me and said, if this dog leaves our clinic tonight, it will die within hours. And the owner was there with the dog, and she said, I'll take my chances. And she brought the dog over to me. I did spend literally 48 hours around the clock doing therapies on this dog. And this is her on day
Okay, I'm
three.
trying to do this one-handed.
Chowing down.
She loves this. Oh, hold on, you're getting my finger. Hang on.
I'm trying to video with one
This
hand.
is her eating our absolutely brand new, just came out of the oven, freeze-dried raw food. I think she has a good appetite.
So this was a dog
I
that
like
3
that,
days
huh?
earlier had no chance of living.
My finger.
And
Oh
we
my
were able to
gosh, she
send her
loves
home and
this.
continue her treatments as an outpatient.
I'm going to say that just think about the number of people in the world who are elderly or have got a problem and they're told there's nothing else. We just pack you full of drugs and they walk around like zombies.
Yeah.
And people with problems losing or their ability to be able to walk and stuff like that, paralysis and so on and so forth, are told that's it. I mean, I had that. I was in excruciating pain for a year and a half. Told there was nothing that could be done, and I cured that. So this is just ongoing progression. Incredible, Marlene. Go and tell us about Bentley, because this is a wonderful, wonderful story.
If you want to know more about healing yourself or animals, there are links below. But also watch part 3, where Marlene will just astound you with some of the incredible other work that she's done.